Hello everyone, I'm Dan Faulkner, Registrar and CEO of the Royal College of Dental Surgeons of Ontario. Thank you for taking the time to learn more about progress on our strategic objectives and key issues impacting the dental profession and the regulatory landscape. I really appreciate your interest in the college, and I'm pleased to share some insights into the work we are doing. I'm going to talk about a number of topics today, including strategic plan updates, governance and regulatory landscape, and some of the work that we're doing around the professional liability program. Let me start by describing some of the work that's happening with our strategic plan updates. We have 6 strategic projects. Our first strategic project is college standards. The college is responsible for establishing and maintaining standards of practice for the profession. We've recently developed a priority list of standards to be developed or to be revised, and we also will consult with our stakeholders at multiple steps in the process. 2 consultations were recently concluded. These consultations focused on gathering preliminary feedback before we start writing any standards. The consultations included maintaining a professional patient-dentist relationship and implant dentistry. All the feedback that we received will now go into our work to develop standards that will be received in a draft form by Council at a later date. There's also 2 consultations that are underway: prevention of boundary violations and sexual abuse, and consent to treatment. Council reviewed draft standards recently and has now sent those policies out for further feedback from interested parties, including the public, the profession, and other organizations. Feedback will be used to finalize the standards and will go to Council at a subsequent date for finalization and distribution. The second strategic project is access to care. We recently concluded a broad survey to obtain feedback on our access to care initiative. I want to provide you with a summary of some of the information that we learned from the consultation. There were a number of divergent views that we heard from our stakeholders. Obligations to accept patients on publicly funded programs was the first. Dentists thought that they did not have an obligation to receive and care for patients on publicly funded programs, but other respondents, including members of the public and other healthcare organizations, thought that dentists did have an obligation. With respect to balance billing, dentists were supportive of balance billing, while some of the other respondents from the public and other healthcare professionals were generally not supportive of balance billing. Making fees affordable. Dentists didn't think that they had an obligation to explore and implement innovative ways to structure their practices or deliver services to make their fees more affordable. However, other respondents generally thought that dentists should do so. There was also a lot of general support for a number of concepts and issues. Principles and values of professionalism were provided in a list, and we asked respondents to tell us which ones were important or not important to dentistry. There was strong support by all parties for the principles and values, and the top 3 included competence, honesty, and trustworthiness. The social contract was another element where there was a lot of general support. The majority of respondents thought that it was very important for dentists to uphold their end of the social contract. When we asked, what do you think dentists should do to uphold their end of the social contract, the top 3 responses were providing high-quality dental care and maintaining competence, providing patient-centered care, and establishing and maintaining appropriate dentist-patient relationships, including duty to patients and trust. And finally, there were a number of issues that were very important to respondents. The top things that respondents selected were providing patient-centered care, making practice more accessible, and providing care that is free from discrimination. We also heard dentists raising a number of concerns about the financial viability of practices, and there were concerns raised about the remuneration levels for some publicly funded programs. All of this feedback is really important to the college and will help us in developing appropriate and proportionate regulatory policies. Our third strategic project is service experience. The college, as a public interest organization, has an obligation to provide an appropriate service to members of the public, the profession, and other interested parties. 2 initiatives were recently completed that allow us to improve our service experience. The first is a redesigned RCDSO portal for dentists. On this portal, you will find a new homepage with notifications that help you to understand when you need to provide information to the college. We have a news and information section, and streamlined navigation and instructions to help you move through the portal and find what you're looking for. A second initiative is related to inclusivity and accessibility. We have designed a number of complaints process information brochures in multiple languages: English, French, and 9 other languages. Our fourth strategic project relates to equity, diversity, and inclusion. In October, Council heard a presentation from Rainbow Health Ontario, supporting clinical and cultural competence for the 2S LGBTQ community. We also, in September, approved and released an EDI commitment statement. In that statement, the college is committing to ensuring that decisions that we make are made in a diverse public's interest. As a regulator, we are responsible for reflecting principles of EDIA in education and registration requirements, developing professional standards, reviewing processes, enhancing continuing education expectations, and holding dentists accountable for concerns brought to us. I would encourage you to go to our website to see the resources that are available and the commitment statement that was approved by our council in September. Our fifth strategic project is governance review and modernization. You will have heard of 3 initiatives approved by council to explore for the 2026 district elections. The first initiative is a province-wide election, where one district serves all registrants seeking to serve on council. We're also looking at reducing the size of council from 12 to 10 elected dentists and looking at staggered terms for council members. In addition, council has approved a performance evaluation framework to evaluate itself. We will retain a third-party vendor to observe council meetings and assess council meeting materials in order to better understand how council in its deliberations and decisions serves the public interest. We'll also look at council members to perform a self-evaluation and use that information to continuously improve its work. And finally, the 6th strategic project is practice models and corporate dentistry. Practice models are an emerging issue in dentistry, and we're exploring how this impacts patient care. We have discussed with council to get their perspectives on some of the key risks and opportunities for patients. We're using this feedback to help the college develop recommendations and options to address those risks and opportunities. We'll provide a draft report to council in December 2024 to get further perspectives on the recommendations and options, and a final report will be shared with council in the first quarter of 2025. I'll turn now to the Canadian Dental Care Plan. The college is actively monitoring the CDCP. Recent data from Health Canada in September suggests that over 750,000 Canadian patients have been served by dentists under the CDCP program, and over 8,000 dentists in Ontario have submitted at least one claim. We're seeing a number of large-scale ad campaigns, including from Health Canada to the public. Services that require pre-authorization are now available. And there are a number of emerging issues that the college is actively monitoring or involved in. First, there is an impact that's being seen on patient volumes at university or faculty dental clinics. And we're also working with Health Canada on developing a process for compliance verifications and specifically the on-site audit procedures and the role of the regulator in those. The college has developed a web page filled with frequently asked questions and resources for both dentists and patients. We answer a number of questions that we know are important to the profession and the public, including those related to balance billing, co-pays, and how one enrolls in the program. I encourage you to use this information both for your practice your staff, and for your patients. And you can find this at rcdso.org/CDCP. Let me turn now to the professional liability program. As you know, the college is actively working to divest PLP from the college. Staff have recently designed a procurement process that will allow for PLP to be transferred to a third party, with the goal of allowing the program to continue to operate, albeit under separate ownership. This transfer to a third party could take place in mid to late 2025, but it's important to note that annual dues that are paid in the fall of 2024 will provide full professional liability coverage for the entire 2025 calendar year. The college is working with PricewaterhouseCoopers, serving as our third-party agent for the transaction process. They are currently working with a number of organizations and seeking formal expressions of interest from these organizations to inform the transaction. We're also looking at bylaws and regulations that may need to be amended in order to ensure that all registrants of RCDSO obtain and continue to maintain minimal insurance requirements. As part of these updates, I often talk about the work of RCDSO in terms of highlights or key performance indicators. I'll describe a couple that we have provided consistently to Council. I want to talk a little bit about the registration performance indicators. On the screen, you'll see one of several indicators that monitors how quickly we're able to process applications. The dashed line represents the regulatory requirement. 15 days is the required amount of time by which we have to contact an applicant to indicate whether their application is complete or whether they have outstanding items. The college over the last 2 years has consistently exceeded that timeline. You can see a month-by-month report where we are processing applications well under the 15-day requirement. The second indicator that I want to highlight relates to our facilities inspection program. We monitor timelines from the time that an application is received to the time that it takes to process the facility permit application and assign an inspection. The dashed line represents 2023 and the average number of days it took to achieve that timeline, and you'll see that it's at 30. Our actual performance in 2024 is exceeding that average from 2023. Staff have identified that the new online application process may be contributing to some of these increased timelines, and they will continue to look for ways to improve the online application process and to improve the internal procedures that are followed to drive that timeline down further. One of the areas that I like to keep council and the profession informed about is the landscape in governance and regulation. The Government of Ontario is conducting a consultation on preferred provider networks. They're assessing the impact of PPNs on employer-sponsored drug insurance sectors. The government is trying to determine whether policy interventions are needed or not. And the main concern for regulators is the preservation of values, and specifically, the ability for patients to choose their provider and the professional judgment exercised by members of professions. In our submission, we have signaled to the government that any policy choices that they make must acknowledge that multiple professions are seeing increased corporate ownership, and that corporate ownership is influencing clinical professional judgment. The second area that I want to describe is the College of Nurses of Ontario, or CNO, Workforce Census Initiative. CNO recently gathered information from over 31,000 nurse participants to understand the makeup of their workforce in Ontario and to begin to identify barriers related to diversity, equity, and inclusion that nurses face. Their questions focused on a number of demographic attributes and included Indigenous, ethnicity, race, disabilities, and a number of other identity questions. They will use this to establish baselines and to measure change in the nursing profession. I'll turn now to partners and collaborators. RCDSO has a number of collaborative projects and interactions with organizations in the system. We're currently working with the faculties at Western and Toronto to design large group courses that will focus on common topic areas like record keeping. And the intent is to replace some of the inefficiencies around creating customized program development for dentists who are involved with various college activities. We're also working with the Western Schulich Medicine and Dentistry faculty to develop a proposal for funding from the Oral Health Access Fund for an educational program in professionalism. And finally, we're working with Health Canada to ensure that CDCP considers the regulatory community input and future initiatives like on-site audit processes that I mentioned earlier. The college is actively engaged with the Ontario Dental Association, meeting regularly to discuss issues of common interest, and these include CDCP, access to care, priorities for college standards and how ODA can provide their feedback to all of our standards development work, and collaborative approaches to identify dental supervisors for multiple purposes, such as the emergency class of license that was recently approved last summer. And finally, the college is proud to have entered into a partnership with Rainbow Health Ontario. We recently approved Rainbow Health as a sponsor for continuing education points. I would encourage you to access the Rainbow Health website. They have a number of programs that are inexpensive and pertinent to healthcare practitioners who serve the 2S LGBTQ communities. I'll turn now to outreach and resources. We've had a number of events where the RCDSO has played a leadership role. In June 2024, we had our first in-person RCDSO Connect event in London, Ontario. We were pleased to provide a number of different topics to the community, which included dentists, other oral health providers, and members of the public. And we got valuable feedback from participants in topics like access to care. The college also recently provided a presentation to a national regulatory group, the Canadian Network of Agencies for Regulation, or CNAR. Holding its conference in October 2024, the college was on a panel to present issues that related to access to care and access to justice with partners from the Law Society of Ontario. As I often mention, there are many resources online that we encourage dentists and members of the public to keep up to date on and look at. 2 new resources have been added. You can see how the RCDSO and the ODA define their unique roles. We partnered with the ODA to develop a number of ways to represent what both organizations do, what their mandates are, and how they work with both the profession and the public. We've also recently posted an infographic on social media and how the dental profession should consider their social media interaction. Called Pause, Think, Post, we want to ensure that members of the profession are fully aware of their responsibilities in social media use. I want to wrap up by reminding you that our practice advisory service is available to answer any questions you may have. I also encourage you to follow us on social media for the latest news and updates from the college. Thank you again for your interest in our work.